Hello, I'm Robert. I help people scared of various things, but this time it's something real. Often it's things that are just fake news, but this is a real thing, Covid-19. But there's so much, the infodemic is absolutely enormous. And as well as that, we have that it's even spread to the point that the United Kingdom is basing its policy on what is something that's not true. So this is my letter. So first of all, take great care if you're in the United Kingdom with washing your hands very thoroughly. I'm going to do another video about that, just reminding you all of what you have to do, and keeping a distance, and not touching your face and so on. So I'll give another reminder about that. But this one, you can help by trying to get some answers from our government about why they're not following the advice of the WHO, and to get some genuine science debate. We get these people talking BBC Question Time and such like. That is not a science evidence-based debate. That's just people shouting at each other, really. They don't go into it in the nitty-gritty of the science and evidence. And we need a proper science-based, evidence-based science debate and discussion, and the government needs to explain clearly that what they're doing is different from what the WHO say, and explain why they're doing such a different thing. Anyway, this is my letter to the Prime Minister. I sent it. I have no idea if he'll read it. It's probably one of thousands that he's getting. But anyway, dear Prime Minister, the WHO say we have a precious second window of opportunity to win against the Covid-19 pandemic. But as Italian scientists said, the virus is very fast and really lethal. Every minute is exceptionally important, as it means saving lives. I'm asking with great urgency for public evidence-based science debate with WHO experts on the basis for your Covid-19 policies. They differ from WHO recommendations radically, putting not only us, but other countries at risk from Covid-19. They are based on a fictional flu pandemic, but the real virus is most unusual and different from flu, a rare type of respiratory virus that can be contained and stopped. The WHO say there is a precious second opportunity. With the country in lockdown, we can go after the virus in the community, find it, contain it, and stop it. It will take a massive scale-up in contact tracing. However, the legendary British fighting spirit can rise to this challenge. Yours sincerely, Robert Walker. And BSc M.Hum. I don't seem to put that on there. I did on the actual email. So now here's some screenshots. So I've sent this to various other people. I've just now sent it to John Ashworth, the Shadow Secretary of Health. And I'm just, anyone you can think of to send it to, I'm sending it to. So this is the next bit, is test your understanding of Covid-19. These are UK government policy. Do you know what the World Health Organization recommends? I bet most of you in the United Kingdom don't know, because I haven't seen the WHO policy on TV. And unless you follow the WHO press conferences and really hunt around in the website and the techie details, you're not going to know this. So first of all, Covid-19 can't, so this is what the UK says, Covid-19 can't be stopped, but it can be delayed, and they're trying to push back the peak. Flatten, lower the peak, in order to give the NHS more time. Suspected case of Covid-19 should only be tested if the condition is serious enough to require an overnight stay in a hospital. The virus that causes Covid-19 is airborne. These things are all wrong. The little X at the end means this is incorrect. A third of the transmission happens in the community. Incorrect. A third of the transmission is through asymptomatic cases. Incorrect. If you are infected with suspected Covid-19, it is likely others in your household are infected already or will infect each other. Incorrect. Only one. I'll do the answers in a minute. The quarantine period for Covid-19 is until 7 days after you feel unwell. If in a household with others, all quarantine until 14 days after you feel unwell. Incorrect. There are several others they got wrong, but those are some of the main points. This is what the World Health Organization say. Covid-19 can be stopped. It's no longer a question of whether we can, but if we will. After the big WHO China report, then they've been saying that before, we've got to do it, but they then said, we absolutely know for sure that we can stop it. And the experience of Singapore and the experience of South Korea and China, of course. Every suspected case of COVID-19 should be tested. The virus that causes COVID-19 is not airborne. That means you can't get it just by breathing out and someone else breathes in. It's talking, coughing, sneezing, or touching a surface that someone else has coughed and then touching your eyes, nose and mouth. Most transmission in China, about 75 to 85%, happen in households. And most of the rest is due to some other forms of close or prolonged contact. That's from the big WHO China report. Nearly all cases of COVID-19 will show noticeable symptoms at some point. They're not asymptomatic. They can infect asymptomatically, but they later discover they got it, and then you can trace back. Or they were symptomatic and they've lost and they've stopped, and then as long as you're doing quarantine properly, you get that extra 14-day period for getting them to quarantine. Caring for infected people at home may put others at risk. It is critical to follow WHO guidance. For instance, patient and carer must both wear medical masks. There, I'm quoting Dr. Tedros directly. Quarantine for COVID-19 continues until the patient is symptom-free, and once they are well, it continues for an additional 2 weeks. And then our real priorities for COVID-19, I talked in my previous video just now, just to quickly summarise. You've got to test all the cases, isolate them while they're waiting for tests, quarantine anyone who has it. Utmost priority to do that in the UK now, because we don't know where it is. Trace all the contacts that they had for the previous 14 weeks. Ask them, if you went out for someone for lunch, a week ago, then you ring them up and say, you had a lunch with someone who had COVID-19, please isolate yourself. And then you test them. If they show any symptoms, they've got to ring someone up, and then they get tested, even the mildest symptoms. Quarantine anyone who has it till 40 days after they get better, as I already said, and physical distance is a defensive measure. All we can do is to buy us time. We can't win without going after the virus. And then I ask these people, people I send this to, since I haven't heard anyone challenge government on these points, it seems as though nobody knows this. Do check with Dr. Tedros or Maria Van Kerkhove or Mike Ryan, Dr. Mike Ryan, I'll fix that to get their names right. It's the doctor in the van. They repeat these points in just about every press conference. I've watched every one that they did about COVID-19. Or check with Dr. Bruce Aylward, who's a very distinguished leader of the WHO China International COVID-19 report. Using a fictional flu pandemic to guide decisions about a lethal new disease with different characteristics is dangerous. Real-world diseases might not respond to control measures in the same way as fictional diseases such as used for planning exercises and may not always match previous experience of influenza. We don't have the leisure of time to learn from these mistakes. And then I link through to my main article. So that's what I say to them. If I do any more, I think I might just add a little link to the link to the flu experts. Anyway, to link to the Italian people who wrote urging us very desperately to follow, saying every minute counts, as I said at the beginning. That's in the letter. Every minute counts. I think I should do a link to that. But as Italian scientists said, the virus is very fast and really lethal. Every minute is exceptionally important as it means saving lives. I'll add a link of that at the end. I put a link to this in the email, so they will be able to find this. I'm going to add this video to it. Maybe me reading it out might help a bit. So there we go. So next I'm going to do about how you protect yourself from COVID-19. And just a short video on that, keeping these very short, 10 minutes each. So yes, hope this has helped. I do please. I've got this, and I've got the series of tweets that I've sent to these people, and do retweet, ask people, really get people talking about this in the health service as well. And I know it can't help. It's going to be a bit scary. It's a bit scary to consider the possibility that the government could be giving you wrong advice. And the WHO do not never criticise a government in public. They may be criticising in private, but they will never criticise a government in public. And as the Italian scientists said, and the scientists urged people around to urge people to tell the governments to do these things. And if there's any mistake in anything I've said, please tell me, and I will correct it, and I will apologise, and I will say what was wrong and so on, and I correct anything that's any mistakes in immediately. So anyway, please share and get people talking about this, and this needs to be. It can't just be the government telling everyone what to do like this, based on this fictional flu, and then nobody discussing the science behind it. We have to discuss the science, and it has to be done publicly. We have to have a public, thorough, clear discussion of what the science evidence is for their policy, and why their policy is so different from the WHO, and the science evidence for the WHO, the science evidence for the UK government, and the decision of, and then publicly involved in why we do one or the other.